Hey guys, welcome back to my channel. As you can tell from the title of this video, we're going to be doing dosage calculation problems. You're probably here because you're a nursing student, and most nursing programs require you to get 100% on the dosage calc exam, which can be frightening, but it is necessary because you're literally going to have somebody's life in your hands. So I'm here to show you a quick and simple way to do these problems and to give you the confidence boost that you need when you use this in clinicals. Okay, so first I like to look at what is the question asking me. This question is asking how many tablets will you give? So I go ahead and I write a T on the side just as a reminder that in the end I'm looking for tablets. Then I look at what did the doctor order. Here the doctor ordered 500 milligrams. So I'm going to put 500 milligrams per order. Then you're going to look at what we have on hand. On hand, we have 250 milligram tablets. So I'm going to put that one tablet is 250 milligrams. Now we can cancel out the milligrams on the bottom and the top, and we're left with tablets per order. You're going to multiply across and then divide it by the bottom. It's 500. Divide that by 250, and that's going to leave you with 2 tablets. So that is the answer for the first one. Let's look at number 4. It's asking how many mLs would you draw up? So we're going to put ml to the side because we know that that's what we want to end with, right? So now we look at what the doctor ordered. The doctor ordered 75 milligrams. We're going to put that at the top. 75 milligrams per order. Then we're going to look at what do we have on hand. On hand we have 50 milligrams per milliliter, right? So I'm going to flip the equation so that I'm able to cancel out my milligrams. So I'm going to put 1 ml over 50 milligrams. Now, since I flipped that, I can cancel out my milligrams, and I'm left with milliliters, which is what we need, right? So I multiply across and divide the bottom. This is going to be 75 milliliters over 50. And then when you divide the 75 into 50, you're going to get your answer, which is 1.5 mLs. And that's your answer for number 4. Now we're getting into flow rates. The trick with flow rates is that you're always going to round up to a whole number. And if you think about it, it makes sense. You can't set an IV pump to 0.5 or 0.7. So in the end, if your answer is a decimal, you're going to either round up or down to that whole number. This question is asking mLs per hour. Go ahead and put mLs per hour. Now we're going to look at what the doctor ordered. They ordered 1,000 mLs. And then in our question, they already gave us the hours, 8 hours. So here, the question already gave us the milliliters over the hours we need. We just need to divide it so that we know how many milliliters for 1 hour. So you're going to do 1,000 divided by 8. And that's going to give you 125 mLs per hour. And that's your answer for that one. Okay, so we're on question 8, and this is asking for drops per minute. So just like the flow rate, the drip rate needs to be a whole number. It makes sense when you're thinking about it, because if you're setting up an IV pump, you can't give somebody 0.5 of a drip, right? So the doctor ordered 1,000 ml bag over 12 hours. 1,000 mLs to be given over 12 hours. Now we're going to look at our drop factor, which is 15 drops per ml. So you put your 15 drops per 1 ml. You can go ahead and cross out your mLs. You're left with drops per hour. Our question is asking drops per minute. So we have to convert the hours to minutes. Since our hours are on the bottom, we're going to put hours at the top over here. 1 hour is 60 minutes. Cross out your hours. Now you're left with drops per minute. That's exactly what we need. So we can go ahead and multiply across and divide the bottom. So 1,000 times 15 is 15,000. Then we're going to put that over the 60. Then you divide 15,000 into 60. So your answer is 250 drops per minute. Okay, so now we're going to do a dosage calc for a pediatric patient, which is number 10. It's asking how many milligrams will you administer? Put your milligrams on the side. Then look at what the doctor ordered. They ordered 5 milligrams per kilogram. 5 milligrams per 1 kilogram. Then you look and see, what does your patient weigh? And our patient weighs 22 kilograms. We're going to put 22 kilograms at the top over 1. Now you can mark out your kilograms. And you're left with milligrams, which is what we need, right? So from here, all you do is multiply the 5 by the 22, which is going to give you 110 milligrams. And that's your answer for that one. So we have another weight-based problem, and it's asking for units. Put units over to the side. So the order is for 12 units per kilogram. We're going to put 12 units per kilogram. Now we need to look at, what does our patient weigh? So our patient weighs 75 kilograms over an hour. So from here, you can mark out your kilogram, multiply across, divide by the bottom, and then your answer is going to be 900 units. If you made it to the end of this video, thank you. I appreciate you. Comment down below and let me know, what do you struggle with most with Dosage Calc? Don't forget to like, comment, subscribe, and hit that notification bell so you don't miss my next video. And I'll see you guys next time.